Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Azimilide. Azimilide will actually block the rapid and slow. They will block the rapid and slow components of potassium channels. And this azimilide is under trial. It is present under trial and it will convert the atrial fibrillation. It will actually convert the atrial fibrillation rhythm to a normal rhythm. So, this can be used in the conversion of atrial fibrillation rhythm to the normal rhythm, but still, this drug is under trial.
thank you and thank you for watching.